Okay, I'm feeling very tired, but it's fine. It's fine. Is it fine? Well, I don't have a choice. I don't know what's wrong with me. I'm tired all the time. Okay, let's do OCD. Let's do the whole of OCD in this video. Let's get into it. Okay, so straight into OCD. Georgie here has OCD. Let's establish the behavioural categories of OCD. They are avoidance, reduces anxiety, and compulsions are repetitive. So Georgie's, the source of her anxiety, the source of her obsession is germs. So her compulsions are repetitive. She repeatedly needs to wash her hands and wipe down any surfaces she's working on. And what else? She has to brush her teeth every hour or so. Okay, so that's the compulsions are repetitive. Now the compulsions reduce anxiety. The obsession with germs gives Georgie anxiety, so when she takes part in the compulsion, this reduces her anxiety because it's taking away from her anxious feelings around germs giving her illness, or just she doesn't like germs, she's not a fan. Okay, so compulsions are repetitive, they reduce anxiety and avoidance behaviour. Is that it? Yeah. Okay, Georgie will... So she'll avoid situations. Yes, she will avoid situations that trigger the anxiety. So Georgie is not going to be going anywhere near the dishwasher. She's not going to be like outside, like having fun, like in the forest or the woodland, or she's not going to be like trying to get her hands mucky. Georgie absolutely hates art. Because in art, that means getting pen and chalk and all sorts of things on your hands and having to touch other paintbrushes and things that other people have used. So Georgie is avoiding the trigger of her OCD germs, her obsession, by staying away from situations where she knows germs are likely to be. Okay, have we done all of them? Repetitive anxiety, avoidance. Okay, those are the behavioural categories of Georgie's OCD with germs. Now let's look at the emotional characteristics of Georgie's OCD. These are anxiety. What else are they, Georgie? How else do you feel? You feel anxious. Oh, okay, I remember. Because I looked in the book. Okay. She feels anxious and distressed. So that's what I've just said about anxiety, and then the compulsions reduce anxiety. So it's making her feel anxious. She might have a panic attack, anxiety attack, whatever. The source of her obsession with germs are giving Georgie anxiety, okay, and they're distressing her. Guilt and disgust. Georgie feels guilty. Why do you feel guilty, Georgie? We've got to know. Okay. She said she feels guilt. Okay, Georgie feels guilty just because... Why do you feel guilty? Because she does, okay? Just let her be. She's feeling a bit guilty. It's part of her OCD. And she's feeling disgusted. Okay, so the disgust for her OCD could relate to... She feels disgusted when she doesn't clean herself, when she doesn't engage in a compulsion to reduce the germs. For the other ones, for trichotillomania, hoarding disorder, and exoriation, the disgust can be directed much more self-inward as a result of the compulsions. So like hair pulling, you might be disgusted by yourself from pulling the hair. Like if you see balding patches or you're experiencing hair loss, or with hoarding, you might be disgusted at the amount of stuff you're hoarding and storing and the lack of hygiene if you're, as a result, you're not hygienic. And exoriation, you might be disgusted at the way your skin looks. Okay, so that for the other ones, disgust is much more as a result of the compulsions, whereas for typical OCD, like for Georgie, the germs, the disgust is really what she feels, what is making her engage in the compulsion. And then guilt as well. And she also feels guilty. Why do you feel guilty, Georgie? Do you feel guilty because you're doing the compulsion, or does the compulsion help you to not feel guilty? Oh no, this is the one that we suggested. Georgie doesn't know why she feels guilty, and neither do we. And anxiety, distress, and it's accompanied by depression. OCD is most of the time accompanied by depression, which it makes sense why somebody who has a source of obsession or compulsion as severe as somebody with OCD needs to have, why they would then also feel depression as alongside that. Cognitive characteristics of OCD. Obsessive thoughts. So Georgie is constantly thinking about hygiene, germs. It's constantly on her mind. So her cognitions are constantly focused on it. Her thinking processes are constantly driven by this disgust and germ fear. Cognitive coping strategies. This is how you respond to your source of OCD, your source of compulsions. So in the book it says a religious person who's feeling very morally guilty might respond by praying. Georgie is not religious, so how are you going to cognitively cope with this, Georgie? She is going to cognitively cope with it by I don't know what a cognitive coping strategy for germs would be. Maybe having like cleaning rituals. So, but isn't that a compulsion? Anyways, Georgie has got some cognitive coping strategies going on. Insight into excessive anxiety. So alongside OCD is excessive anxiety. So it's more than what a normal person feels, and it's very extreme. And they need to be aware that for them to be diagnosed with OCD and not a different disorder such as schizophrenia, you need to be aware that their compulsions and obsessions are irrational. Now I'm going to go on to the the biological approach to explaining OCD. The biological approach to explaining OCD suggests there's a genetic and a neural explanation. The genetic explanation is that OCD candidate genes are involved. Lewis observed that of his OCD patients, 37% had parents with OCD, 21% had siblings with OCD. So this shows there's a genetic correlation. According to the diathesis stress model, certain genes leave some people more likely to develop a mental disorder, but as it's not certain, some environmental stress is necessary to trigger the condition. So you can have a genetic vulnerability, like passed down through your parents, but that doesn't necessarily mean you're indefinitely going to develop OCD. You might need to experience an environmental stress, like a trauma, for the OCD to be triggered and developed. Candidate genes, some of the genes involved in regulating serotonin have been implicated in OCD because serotonin is a mood-regulated neurotransmitter. For example, the gene 5-HT1 minus D beta is implicated in the transport of serotonin across synapses. OCD is polygenic, which means lots of different genes may be involved in what causes OCD, not a singular gene. Stephen Taylor analysed findings of previous studies and found evidence that up to 230 different genes may be involved in OCD. Genes that have been studied in relation to OCD include those associated with the action of dopamine and serotonin, both neurotransmitters believed to have a role in regulating mood. Okay, different types of OCD. So it's etiologically heterogeneous, which means OCD is caused by different variations of genes in different people. Okay, neural explanations. The role of serotonin as a mood regulator. So this is suggesting that the neurotransmitters relay information from one neuron to another. If a person has low levels of serotonin, then normal transmission of mood-relevant information does not take place, and so their mood regulation is disrupted by the low levels of serotonin. Decision-making systems. Some cases of OCD, and in particular hoarding disorder, seem to be associated with impaired decision-making. This, in turn, may be associated with abnormal functioning of the lateral bits of the frontal lobes of the brain, because the frontal lobes are responsible for logical thinking and deeper processing. There is also evidence to suggest that an area called the left parahippocampal gyrus is associated with processing unpleasant emotions, and this functions abnormally in OCD. Okay, so there's a brain structural what is the word? Relationship with OCD. Okay, evaluation. The biological explanation is good because we can observe it with modern brain scanning techniques, which provides objective data and findings. What else can we say? I don't know. You can always say that it's socially sensitive to suggest it's caused by genes, because putting pressure on the parents, and also people might not receive proper treatment that they would have otherwise received if they just assume it as biological. Okay, there's also research support for the genetic explanation comes from twin studies by Nestat. He found 68% of identical twins shared OCD as opposed to 31% of non-identical twins. Okay, so this supports the correlation of OCD in family. Environmental risk factors may also be involved as a limitation of a genetic explanation. Kyara Kramer found that over half of the OCD clients in their sample had experienced a traumatic event in their past. So this suggests there's a correlation with environmental factors. But this also supports the diabetes stress model. Research support for neuroexplanations comes from antidepressants by Nestat and no unique neural system, comorbidity, neural systems working together, getting correlation and causality. According to the biological model of mental disorder, this is most easily explained by the brain dysfunction causing the OCD, as there is evidence to show that some neural systems, such as serotonin, do not work normally in people with OCD. However, this is simply a correlation between neural abnormality and OCD. Okay, so a lot of the biological explanation is based on correlational ideas or correlational research, which this lacks validity as it's ignoring environmental factors or extenuating circumstances or traumas or other factors that may be implicated. Okay, that's all of OCD done. Now I need to go back and finish depression and phobias.